Hi moms, hi dads, hi parents. I want to discuss a subject that is very common but not really talked about. When your newborn is born, sometimes jaundice can occur into the infant. Jaundice is a yellowish tint around the baby's eyes, around the baby's nose. The skin is yellow. When this occurs, there are several different treatment plans depending on the level that is in the baby's bloodstream. One, they will do blood work. That's how it's normally called. Sometimes your baby can be discharged from the hospital and then you might see some yellowish on the nose, around the eyes, and definitely it's not normal. Call the pediatrician, that will get you in right away to do blood work. So depending on the severity of the jaundice, what happens is you will either go back weekly for blood draws for the infant, and or they may do phototherapy, which is using the purple light or having you go out in the sunlight or putting the baby in direct sunlight in the home. So there's various different treatments that can happen with jaundice. How the jaundice leaves the body is through poop and urine. So the more that the baby feeds, the more that it can pass through the system. So just if you see any signs of yellow tint on the baby's face or eyes, please know that this is not normal. Go to the pediatrician. If the pediatrician office is closed and it's over a long weekend, take the baby into urgent care because it is a serious matter, but we need to make sure that it's not in a serious state and it's getting addressed right away. Usually what happens is the infant's liver is not mature enough to pass all of this through the baby's bloodstream. So we have to do all of the things that we can do to help get it faster out of the baby's system, which is making sure the baby's eating adequately every 2 hours and the baby is pooping and peeing. And then that's another topic that I'll talk about at another time. But if you have someone that has just had a baby and you're like, oh, your baby looks a little yellow, maybe you should call the baby's pediatrician. So always just be mindful. It is common and it can be serious, but it's very treatable. It just depends on the level of severity once the blood draw is done. So I hope that helps, and look for any yellow or tint on the baby's eyes, baby's nose, baby's face. Can definitely help you get it treated a lot faster. So I hope this helps someone out there, and you will be a little bit more knowledgeable when you see a baby that has a little yellow tint. You can say, hey, go ahead and call the pediatrician, get the baby in right away. So I hope this information helps out someone out there with knowing the treatment of jaundice, what jaundice is, and how you can spot it, along with how you can help get it out of the baby system fast.